was when I, coming out of the School of Medicine in France, where I'm from, and going and working for the first time in my career in Africa. Started by Algeria and went to Chad, and I learned to see one thing that I've never forgotten since. In all countries, we have beautiful hospitals, beautiful resuscitation wards. I learned to see kids dying, and that's a lesson that I've never forgotten since. Kids dying because I could not do anything. I didn't have the tools. And when a kid is coming to severe malaria, it's a fight of the last moments that you're fighting against a bug, a damn intelligent bug. Malaria costs a lot in Africa. You need to understand as well that in Africa, 40%, and it is estimated that 40% is spent by families and public health, in fact, and by public health government on malaria. A lot of budget goes there that should not go there, could be used to many other utility and possibilities in the country. So why do we need research and development when in fact we seem to have interventions? Yesterday and the day before yesterday, I was working on a paper on vaccines in malaria, and I was sent by a friend a paper on resistance on artemisinin. At the border, you have to go at the border of Cambodia and Thailand. And that brought me back to the 60s. My gray hair gave me that privilege. When, in fact, at the same place, at the same site, the same region in the world, the first cases of resistance against chloroquine came up. And that's an alarm bell that is ringing. If we don't work on developing new medicine that are going to complement artemisinin and make it new developments for the tools that we have, in 5 years, in 10 years down the road, we're going to be without any weaponries against the bug. This parasite has been around for millions of years. So one parasite is not around for millions of years without being very wise, being very able to adjust to immune system, to mosquitoes, to human beings, and to get the possibility to keep on living at a low level and come back with a revenge. Remember Sri Lanka in the 60s and the coming back of malaria, when in fact the first campaign on elimination and eradication failed, in fact, because of resistance and because of fatigue at that time. So there are many things that have to be done to keep the fight going. So we see a resistance to drugs. Bed nets are critical today. They are giving fantastic results. Fantastic results because it's such a pleasure to see when visiting sites in Africa that beds are empty because malaria is going down. When we do clinical trial on the vaccine, such good news to understand that we have to increase the numbers because the number of cases are going down. At an MD, I love that. And going to that intervention, you say, at the moment you think, on those bed nets, we are using one insecticide, the same class of insecticide for the past 2 or 3 decades. There's an emergency to develop, and people are working on developing new insecticides to keep those bed nets effective as long as we can over the duration of this fight. At the same time, we need data in Africa. We need to understand what's going on, impact of all those interventions. To measure impact, you need very good diagnostics, quick diagnostic that can be used in the field. Because we are investing many millions, so we need to understand what those millions are doing in the field. And quick diagnostics, important research going on, are going to help the battle. Because when the battle will come to the time when no more diseases are going to be seen, you will have to keep on surveying for a long time to be sure that the parasite is not active anymore in pockets. Keep in mind that the picture of malaria today is a puzzle across Africa. In one place you don't see cases, you go 20 kilometers further down the road and there is a very high incidence. So that's the way malaria is today in Africa. So from my side, the good news is that we've started a clinical trial a couple of months ago in 7 countries, 11 sites in Africa, means we are bringing a vaccine to phase 3. It's never been heard of before. We're going to immunize 16,000 children, and we have already enrolled close to 4,000 of them, which is very interesting because, as coming back to my career in vaccine, the awareness of a vaccine can be measured at times during your last large trial. When people come, when you can enroll quickly, that means awareness for malaria is very high. People are interested in the development taking place. They come. it's a very good omen for what's going to happen when the vaccine is going to be made available. So, coming back a little bit to Malaria Vaccine Initiative, what we are doing basically, we're investing to accelerate the development of malaria vaccine and ensure that they are made available and accessible in developing countries. Very important part of what we are doing. What I would like to come back to that clinical trial. We are working with GSK, large pharma company. We are a public-private partnership, being sure that those vaccines are going to be developed. There's no market for a malaria vaccine. So if we don't invest for the development to take place, that will not happen. So we need those investments to see those various projects to go on and see the good tools to be coming and complementing, because the vaccine is going to complement the interventions that are now, be them drug, bed nets, insecticide, in-house spraying using insecticides. What I would like to add is that, and that's very important to keep in mind, this vaccine was developed for the first time. The beginning of the research was done at the Walter Reed, at the Walter Reed Army Institute of Research. That's very important to understand that more than 20 years ago, the Army and the Research Institute was already involved in making the best development that are coming to fruition today. That beyond that, a lot of the people working on vaccines are coming either from Walter Reed, the Navy, or those institutes. That's critical and important to understand the importance of what they are doing. We're working closely at the Malaria Vaccine Initiative with the National Institute of Allergy and Infectious Disease. Why? Because we don't want to duplicate our investment. We want to coordinate, optimize what we are doing. But that means, in fact, another important place where money is used and invested by the American government. I want to highlight as well that USAID and the Malaria Vaccine Unit branch of USAID is investing, is giving us money to develop the new product that are going to come down the road. The first vaccine is giving 50% efficacy in the trial that we have done in Tanzania, in Bagamoyo. And we're aiming now at developing interventions that are going to target 80 to 85%. We are investing in developing vaccines that are targeting the mosquito. It's interesting, you're using human beings to develop antibodies that are targeting the mosquito. That's why I called the immunological bed net. That guy is not going to be able to transmit anymore. Can you imagine if that vaccine comes? The dream for me would be one day to go in one place, have all the interventions and stop transmission in one place for 2 seasons by combining all that. We would have won the battle by spreading around that strategy. So, just to highlight that it's a difficult battle. The malaria parasite, it's not only one, we've got 4 of them and potentially a 5th one that is coming up that suddenly we've discovered was not only limited to monkeys but was able to come back to human beings. So something that is moving, that is changing. 6,000 genes. So that means a lot of potential to play around with all the interventions that are available today. A very wise bug. So, and I would like basically to highlight that if we don't invest today, as has been done for many years, as the American government has made, the President Malaria Initiative and other very important initiatives that have been made that have an impact today, we might not see the day where we are going to be in a position to eliminate the thing, because that's what we have as a target. Just I would like to, because we were talking about the empty bed nets, and I would like to, because we brought a little brochure, a little bag here, and that's a picture of the place where those bed nets and those beds, were found empty during the visit, recent visit to the site. That's something that I would like to highlight at the end of this talk. Those are the 5 first kids that were immunized by RTSS in our phase 3. What I would like to highlight is that science is taking place now in Africa. That's something that is very important. It's not only spreading, in fact, intervention, but it's also creating in Africa the brains and the development that are going to go on with us, developing the tools that are going to win the battle. That's what a lot of people are doing and that we need to keep on doing. Salim Abdullah, one of the most, in fact, beautiful scientists that I have seen in my life, working in Bagamoyo in Tanzania and fighting the battle against malaria. And the second thing, a map. It's always interesting to see a map of all the countries where we are having that clinical trial going on. The 16,000 kids that are going to be enrolled, and we do hope that a little bit more than 5 years down the road, we are going to have that vaccine that is going to complement the intervention that are at the moment taking place.